The name of his book is The End of Mental Illness: How Neuroscience is Transforming Psychiatry and Helping Prevent or Reverse Mood and Anxiety Disorders, ADHD, addictions, PTSD, psychosis, personality disorders, and more. But the main title is The End of Mental Illness. That is a provocative title. You're not mincing words there. What do you mean by the end of mental illness?
I hate the term mental illness. I've been a psychiatrist 40 years now, and I've always hated it because it shames people. It's stigmatizing. When you call someone mental, that's not a good thing. And it's wrong. Based on our database of now 160,000 scans on people from 150 countries, we've really come to believe that most psychiatric problems are not mental health issues at all. Rather, they are brain health issues that steal your mind. And this one idea really changes everything. Get your brain right, get the physical functioning of your brain right, and then your mind is better because the brain creates the mind. And very few people are talking about the impact of traumatic brain injury on mental health challenges, on a bad diet, on hypertension, diabetes, mold exposure. And we need to stop what we're doing because it's not working. Tom Insel, director of the National Institute of Mental Health, said outcomes in psychiatry are no better than they were in the 1950s. And that should horrify us. And I believe what we need to do is change the paradigm. Now, it doesn't mean psychology and psychotherapy is not important. Of course it is. But I think of it as optimize the hardware of your soul, your brain, and then program it. But too often people try to program it, and when the hardware is not working right, they become demoralized, they become depressed, and they stop seeking help. So we need a new paradigm. That's the idea behind the end of mental illness.
To be clear, and I want people to understand this fully and completely, and so I'm going to play devil's advocate for a minute. And I am playing devil's advocate because because of conversations you and I have had both on and off camera, that I agree with what you're saying. But to play devil's advocate and ask a few questions, you're not saying that if somebody is showing what we now call schizophrenic behavior patterns or depression or panic disorders or anxiety or whatever, that's not real, that those are not real disorders, that people aren't really having disrupted lives from schizophrenia or depression or whatever. You're not saying that those are not real disorders, correct?
Correct. They're completely real. But being schizophrenic or being depressed doesn't tell you one thing about why you're schizophrenic or why you're depressed. Think about it. Lincoln, and I'm a huge Lincoln fan, had severe depression during his life. He was actually suicidal in the winter of 1840. And how did his doctor diagnose him? So his doctor was Anson Henry. He talked to him. He looked at him. He looked for symptom clusters and then diagnosed and treated him. That's exactly how depression is being diagnosed today. Depression is a symptom like chest pain with many different causes. And if we don't understand what's causing it, that's why at Amen Clinics, we look at the brain. How do I know? Does your brain work too hard or not hard enough? Is it toxic or traumatic? That we really need to change how we approach these things. It's not that bipolar disorder is not real. It's totally real and will ruin your life if you don't treat it properly. But we're not talking about why do you have it? And oh, by the way, if we get your brain right, your medication is going to work so much better.
two things that have always stuck out to me. One is that when we use psychometrics, people think we're measuring depression or anxiety or whatever, and that's absolutely not true. With psychometrics, what we're doing is we've given these test items to lots and lots of people, and when you take a test and you come back and score high for depression, we can't really say you're depressed. What we're saying is you have an awful lot in common with people that we have observed to be depressed. We gave these test items to a big population of people that we observed to be depressed, and you answered the questions the way those people answered the questions. So when you take a psychometric test, we're basically comparing your answers to people that we've clinically observed to behave in a way that we've labeled as depressed. And so I think people misunderstand how psychological tests work. And then secondly, these drugs that we give people to treat schizophrenia, depression, bipolar, if you go look these drugs up and look in the section where it says agent of action, how it works, most of them it says unknown. It just says we've given these people and some people get better, but we don't know, which means they don't understand the relationship between the brain or the biochemistry and this symptom pattern. They just gave them these and some people got better, so they licensed the drug and gave it to them without really understanding how the brain or the body actually responded to them. That's scary to me.
And that's common, right? That's how most people are diagnosed and treated without any biological information. And I love being a psychiatrist, but I belong to the only medical specialty that virtually never looks at the organ they treat. And they call me crazy. And I'm like, no, more information, like Cameron, the kid you and I did together, he was dropped like 10 feet onto his head. And yes, he has mental health problems, but he's failed all these doctors. And because nobody's asking, well, why is he depressed? Or why is he addicted? And if you don't look, you don't know. And then you come up with all sorts of crazy ideas on, well, this is why people are depressed. It's because they have a serotonin deficiency. It's like, no, you broke his frontal lobe or his temporal lobe. Let's work on fixing that. And then he's likely to get much better.
You say since 1999, suicide has increased 33%, enough so that it's decreasing overall life expectancy. And during the same period of time, cancer has decreased 27%. To me, that speaks to the fact that the stigma is there. People are not asking for help when their actual quality of life has eroded to the point that they can't endure it anymore. But cancer, they get help because there's no stigma. So one's up a third, the other's down a third.
And since the pandemic, I think suicide is up way more. I've just never seen anything like it. And it's because we're working on the wrong paradigm. Why are we making such progress in cancer and heart disease and virtually every other aspect of medicine, but we're not making progress in psychiatry? And I think it's because the paradigm is wrong, making diagnoses based on symptoms with no biological data. And the end of mental illness is trying to go, there's another way to do this. And we study our outcomes at Amen Clinics. So we've been doing it since 2011. If you come to see us, we actually enter you into a formal outcome study. And on average, patients have 4.2 diagnoses. They're complicated. They have failed 3.3 providers and 5 medications. And at the end of 6 months, if we treat them, 84% are better. No one's got those outcomes that publishes them. No. And it's because we get more information and we're decreasing stigma. But what I love, we increase compliance. People want better brains. And so, like with my NFL group, they like being coached. And so they'll do the things knowing that in 4 months or 6 months later, I'm likely to rescan them and go, are we doing better? And I just get so excited about that. And I mentioned to you when we were not on camera about this kid, Jose, who came to see me because of your show. Like 10 years ago, you were doing a show on compulsive cheaters. And he cheated on his wife 8 times in 4 years. His wife had a gun. She was going to kill him. And as part of the show, I got to scan him. He had a damaged brain from football, mixed martial arts, had terrible habits. And when we fixed his brain and 7 months later, I scanned it so much better, he's making better decisions. And I don't know if you'd agree with me, but ultimately a person's success in life is a sum of all the decisions they've made. And as you make better decisions, your wife doesn't want to kill you anymore. You're more likely to not have to visit your children on the weekend. And he just graduated from nurse anesthetist school. I'm just so proud of him. With a better brain comes a better life.